Global surgical period. So global days are the number of days after the surgery that the patient comes into the doctor for follow-up during their healing process. And each procedure code has days associated with it, and it is published in the Federal Register, but I'm sure depending on where you're working, you would have this information at your fingertips as well. Major procedures usually have a global period of 90 days. Minor procedures are anywhere from 0 to 10 days. And this is a caption in your book. And the XXX does not have a global period policy that is applied, nor does the MMM. Now here you can see there's 10 days for a D&C after delivery. There would be a 0 global day period for insertion of a cervical dilator. ZZZ, this CPT code is related to another service. So what it's saying, you would use the global period of the other procedure. So in this case, I'm assuming, okay, removal of uterus after a C-section, the global period is probably going to be used on that C-section code. Treatment of miscarriage has a 90-day global period, and YYY, that is, the global period is established by each Medicare administrator contractor, so it's going to be those unlisted procedure codes. So you would have to check with your MAC to find out what that global period is for that procedure code, or those unlisted procedure codes. Now I'm going to go through some examples of these global surgical periods in these next couple slides. So patient returns to the surgeon's office for routine post-op follow-up care or a visit. This is included in the payment that was received for the surgery. Therefore, that physician cannot bill or code this routine post-op care if they're within, that global surgical period. So now the visit can be tracked by using the code 99024. Of course, you won't get paid on it, but the provider can decide to report that code and just send a bill out to the insurance even though it won't get paid. Patient returns to the office or hospital due to an unusual or unexpected complication directly related to the procedure. Per CMS, you could not bill or code separately as all related post-op follow-up care, including any complications that do not require a return visit to the OR, are included. Now, other payers, you could code that E&M office visit code with the 24 modifier stating that it's unrelated during the post-op period. So a couple more. Patient returns for a minor procedure in the office due to minor complications. Now per CMS, again, you cannot code because all related post-op follow-up care, including complications that do not require return to the OR, are included. Now other payers, you could code the procedure with the 79 modifier stating that it's unrelated during the post-op period. Patient returns to the office or a hospital for an unrelated E&M service. Now in this case, you could code the office visit E&M code with modifier 24, stating that that service was unrelated to the original procedure. And then here, patient returns to the office or OR for an unrelated procedure. You could code the procedure with a 79 modifier. And then a new post-op period would begin using that 79 modifier. And then here's just a quick example. September, and they had an amputated DIP joint of the finger. November, they're coming back for below knee amputation. 79 modifier is used. And then here, patient returns to the OR for a related procedure. Now you would code that procedure with a 78 modifier, and a new post-op period does not begin because it's related to the original procedure. Here, patient returns to office or operating or OR for a staged procedure that is planned or a procedure that is more extensive to the original procedure. The procedure code would be coded with the 58 modifier, and a new post-op period does begin with modifier 58.